In this video, we are going to see about the histology of urinary bladder. The urinary bladder receives the urine from the two ureters and stores it until neural stimulation causes it to contract and expel the urine via the urethra. It is lined with transitional epithelium, otherwise known as the urothelium, and beneath the epithelium and its underlying connective tissue, the wall of the urinary bladder contains smooth muscle that is usually described as being arranged as an inner longitudinal layer, a middle circular layer, and an outer longitudinal layer. As in most distensible hollow viscera that empty their contents through a narrow aperture, the smooth muscle in the wall of the urinary bladder is less regularly arranged than the description indicates, thus allowing the contraction to reduce the volume relatively evenly throughout the bladder. And if we specifically look at the orientation of this particular micrograph, it reveals the full thickness of the bladder wall. This is the lumen and this will be the outer aspect. The luminal surface epithelium, as you have already seen, is located at the top of this micrograph. One of the ureters can be seen over here as it passes through the bladder wall to empty its contents to the bladder lumen, and most of the tissue to the sides and below the urethral profile is smooth muscle over here. This micrograph shows most of the entire thickness of the urinary bladder. An unusual feature is the presence of this one of the ureters as it passing through the bladder wall to empty its contents into the bladder lumen. The transitional epithelium lining the bladder, it is seen on the right side over here. Beneath the epithelium is a relatively thicker layer of connective tissue which is shown as CT in this diagram. It contains blood vessels of various sizes. You can see the profiles of blood vessels over here and all. And you have to note that the connective tissue stains more eosinophilic than the smooth muscle of the underlying muscularis. The epithelium and connective tissue constitute the mucosa of the bladder. The muscularis consists of smooth muscle arranged in three indistinct layers. It should be noted that as the ureter passes through the bladder wall over this region, it carries with it a layer of longitudinally oriented smooth muscle. We can see the cut section through the longitudinal smooth muscle over here. Medium-sized arteries and veins are occasionally seen in the muscularis. So now we are going to focus on two regions. One region over this rectangle and another region over this rectangle. So first we will look at this rectangle region over here. Then after that we will move on to the next one. So this was the first rectangle region, magnified view of first rectangle. So it shows the transitional epithelium and the underlying connective tissue that represent the mucosa of the ureter. So this is the epithelium and underlying connective tissue over here. This much layer will be the underlying connective tissue, and beneath that we have the muscularis layer. Adjacent to the mucosa are bundles of longitudinally sectioned smooth muscles which are shown over here. These are the longitudinal sections that belong to the ureter, and a small lymphatic vessel which is shown as L by M over here. It is present in the connective tissue adjacent to the smooth muscle. So you have to note the lymphocytes identified by their small, round, densely stained nuclei within the lumen of the vessel. You can clearly see that. Now we move on to see the next rectangle that was showing the epithelium of the bladder itself. So this is the higher magnification of the second rectangle, and it shows the bladder transitional epithelium, which is clearly shown over here. All these are the transitional epithelium. And you can also see some underlying connective tissue also over here. The transitional epithelium is often characterized by the presence of surface cells that are dome shaped. And these dome-shaped cells, among these dome-shaped cells, some of the cells they are binucleate, and these binucleated cells are shown by these arrows over here. And the thickness of transitional epithelium is variable. When the bladder is fully distended, as few as 3 cell layers are seen. Here in the contracted bladder, it appears that there are as many as 10 layers. You can see multiple layers over this epithelium. As a result of the cells folding over one another as the smooth muscle contract and the lining surface is reduced. The connective tissue consists of bundles of collagen fibers. You can see the collagen fiber bundles very clearly over here. And these fibers interspersed with varying numbers of lymphocytes identified by their densely stained round nuclei. A vein filled with red blood cells is also evident in this diagram, which is located in the mucosal connective tissue. So that was in general about the histology of urinary bladder.